Today we are going to learn how to treat a heart attack as well as a cardiac arrest. First, it is important to know the difference between a heart attack and cardiac arrest. Cardiac arrest is an electrical problem, whereas a heart attack is a circulation problem. A heart attack is a situation where not enough blood is being pumped through the heart. This can be caused by a variety of issues resulting in blockage of coronary arteries. Oftentimes, the person will remain conscious while having a heart attack. In extreme cases, they may be unconscious, but will still have a pulse. A person in cardiac arrest will be unconscious and will lack a pulse. If a heart attack becomes bad enough, it can lead to cardiac arrest. Other causes of cardiac arrest are arrhythmias, which are irregular heartbeats, and various cardiac diseases. During cardiac arrest, the electricity in the heart stops functioning properly. The person will also stop breathing. When this occurs, the person is clinically dead. However, there are things you can do as a bystander to increase the survival odds for a heart attack patient and a cardiac arrest patient. The first thing you can do to prepare yourself for a situation like this is to take a CPR class and get certified. Stay up to date on the protocols and do research on your own so you are better prepared. Alright guys, so when we're looking at a person with a heart attack, the first thing you want to do is observe their posture. If they have their hands on their knees, that's called the tripod position, and it indicates difficulty breathing. You also want to observe their skin. If they're pale and sweaty and breathing rapidly, that can also be indicators. Then you can ask them how they're feeling. If they say they're short of breath, they're having chest pain, they may have their hand on their chest, and that's called the Levine sign. And they may have any kind of discomfort between the nose and the navel. Some can even just have stomach pain, and that can still be indicating a heart attack. So what you want to do is call 911, and while you're waiting for help to arrive, if you have any baby aspirin, give 324 milligrams and ask them to chew it. Keep them in a position of comfort and just monitor them until help arrives. Alright, so if you come up on someone who's unconscious, the first thing you want to do is lower them to a flat, hard surface on their back. Then check for a carotid pulse right on their neck, and if there's nothing there, right away you want to start CPR. So you want to put your hands like this, interlocking your fingers, right in the middle of their chest, and push down about 1/3 the depth of their chest, and let it recoil. You're going to do 30 compressions. And if you have a CPR mask, you can use that. They can look like this. Or they can just be a piece of plastic with a valve on it. If you have one of these, what you're going to do is tilt the person's chin up, put the mask on, and then do 2 breaths. And then go back to 30 compressions and alternate like that. If you don't have a mask, I don't recommend doing mouth to mouth because you can get a disease potentially. So while you're doing 30 compressions, 2 breaths, have someone get an AED. And once you have it, you're going to open it up. And there's going to be 2 pads. And on the pads, you'll be able to see where to put them. One goes right above the right chest. The other goes on their left side. And then you're going to plug those into the AED and let it analyze. And while it's analyzing, you're still doing CPR. Once it says to steer clear of the patient, you let go. And once it says shock advised, you give the shock. Wait for it to give you instructions, and if it says to continue CPR, keep doing CPR. You can always keep checking back to see if a pulse comes back, and call 911 and wait for help to arrive.
Hoping somebody someday will do you like I did.